Psychedelics, also known as hallucinogens, are a class of psychoactive substances that produce changes in perception, mood, and cognitive processes. Psychedelics affect all the senses, altering a person's thinking, sense of time, and emotions. They can also cause a person to hallucinate, seeing or hearing things that do not exist or are distorted. Examples of psychedelics are LSD, MDMA, and magic mushrooms. The medical use of psychedelics is a controversial issue because they are not traditionally used to treat mental or physical disorders and can have serious, life-changing side effects. In a study asking whether psychedelic drugs can be used in a medical sense, 65% responded no, showing the controversy surrounding this topic and how many people may not be on board with bringing these traditionally recreational drugs into a medical setting. There are two very different sides to the medical use of psychedelics. One point out the many positive impacts they have on your mental and physical health, while the other side discusses the very evident danger taking these potentially life-altering drugs has on your life.
At the San Diego Convention Center, 1,000 scientists came to discuss how drugs like psilocybin and MDMA alter brain cells, rewire the brain, and because of this, may offer a new way to treat disorders, ranging from depression to chronic pain.
Psilocybin helps rewire the brain by generating new connections between neurons. In mice that receive psilocybin, the size and number of the spines between neurons increased by 10%, allowing new connections to form. Because of this rewiring of the brain, a single dose of psychedelic can have long-lasting impacts on anxiety and depression.
In 4 trials involving 115 participants, psilocybin was found to be safe, tolerable, and effective in reducing depressive symptoms for up to 24 weeks with sustained effects for 6 months. Another study found that for anxiety and depression, psilocybin improves symptoms and quality of life when given psychological support, and after 6 months, 80% of participants still showed significant decreases in anxiety and depression.
Psychedelics have also been found to be very effective for treating PTSD. Therapy, antidepressants, and antipsychotics help many patients but fall short for people who have had multiple traumas or chronic PTSD. These drugs also cause intolerable side effects, and many patients are left to experience PTSD with no relief, making them turn to substance abuse, develop anger management issues, or even commit suicide.
A study found that psilocybin stimulates neurogenesis, the growth and repair of brain cells. In the study, mice that were given psilocybin overcame fear conditioning much better than mice that were given a placebo. This supports how psilocybin can break the traumatic cycle from PTSD. Patients stated that psychedelics help them process the intense feelings they are repressing, helping them accept their emotions.
Those who are against medical use have the standpoint due to the negative physical and mental consequences psychedelic drugs have in the brain that in those cases outweigh the positive ones. Although the use of psychedelics is not associated with overdoses, there are risks with psychedelics, such as the potential for harmful psychological experiences and risky behavior while under the influence.
There have been many cases of injuries from impaired judgment and coordination during psychedelic experiences. Even though one cannot get addicted to psychedelics, they can create an altered state of consciousness which is referred to as a trip. This can be terrifying and impact them long after the effects have worn off.
This altered state of consciousness makes individuals susceptible to negative emotions, fears, and traumatic memories, and some people experience persistent psychological effects such as anxiety, depression, or PTSD.
To conclude, psychedelics have been proven to provide support for various physical and mental disorders more effective than other methods, but there's still significant danger in taking mind-altering drugs that can affect both your brain and body. And even if they're not addictive, that doesn't equal harmless.